Assalamualaikum warahmatullahi wabarakatuh. How are you today? Introducing, my name is Diah Chandra from Aisyah University of Yogyakarta. Today, I will present about our research entitled Self-Efficacy of Hemodialysis Patient in Relation to Personal Care and the Quality of Life. Chronic renal failure or CRF is a condition when the kidney function decreases slowly. CRF disease is characterized by a glomerular filtration rate of about 15 milliliters per minute per 1.73 square meter. The prevalence of CRF increases every year. The prevalence of CRF in Kulon Progo Regency is the second highest in DIY after Yogyakarta City and Gunung Kidul Regency. One of the efforts to extend the lifespans of CRF patients is stroke hemodialysis therapy. This therapy can change the pattern of a person's life, both for the patient and his family. The changes that occur include diet, sleep patterns, drug therapy, and daily activities. These changes result in loss of freedom, dependence of caregiver, disruption of marriage, family, and social life, and experience the loss of income, which can lead to the decreased quality of life. This change in the pattern of life consciously make the patient dependence of family higher. However, hemodialysis patients should still have the ability to perform self-care independently. Self-efficacy is the belief in a person's ability to successfully achieve something. Self-efficacy is very important to manage chronic disease such as CRF. Hemodialysis patients who have a good self-efficacy allow them to be more actively involved in self-care management. Good self-efficacy is also able to improve the quality of life, level of cooperation with family and paramedics, communication, and medication adherence. The purpose of this study is to determine the relation between self-efficacy and self-care and quality of life in hemodialysis patients at RSUD Wates Kulon Progo. By having the results of this study, it is expected that health workers can work together with patients to develop strategies and plans that will improve the patient's quality of life, such as minimizing depression as the disease evolves. The research design of this study was a quantitative correlation method with a cross-sectional approach. The samples of this study were 64 respondents taken by total sampling technique. The instrument of this study was the Generalized Self-Efficacy Scale or GSA questionnaire written in Indonesian, Self-Care of CKD Index that had been translated, and WHO QOL SF36. The data analysis was conducted by having Kendall parametric statistic. This research had obtained an ethical permit from the Ethics Commission of University Aisyah of Yogyakarta. The study was conducted on January the 14th to 19, 2019 in the hemodialysis room of RSUD Wates Kulon Progo. The mean of CRF sufferer is middle adult, rather 45 years and over. Aging would cause a decrease in the mean plasma flow in the glomerular capillaries. Aging also caused hemodynamic change due to the change in kidney structure. Men were more likely to get CRF compared to women due to several factors, namely anatomical factors, hormonal factors, and metric metalloprotease. Hemodialysis patients who had a partner or married would have higher self-esteem and have adequate coping from their partners. Higher level of education had been revealed to be associated with the increased survival of patients having dialysis and indicated a decrease in mortality. Based on occupation, most of the jobless respondents are 26.6%. One of the changing social roles in hemodialysis patients was job change. The physical condition of the respondents became weak as a result of chronic kidney failure. Self-efficacy in hemodialysis CRF patient is the patient's confidence to communicate with caregivers and have partnerships in caring. Figure 2 shows that 64.1% of respondents have a moderate level of self-efficacy. This moderate self-efficacy was related to respondents who regarded that their activities were not difficult but also not easy to do. Thus, other people were still needed in making every decision to increase confidence in every activity. Self-confidence had positive impact on medication adherence, effective disease control, and reducing mortality. There were several factors related to the self-efficacy of hemodialysis patients, namely the level of education, duration of hemodialysis therapy, and adequacy. The lowest average value in the self-efficacy questionnaire domain is in the subgenerality. The physical condition of CRF patient had decreased function. This would result in the reduced confidence of their ability to perform daily physical activities. If this was not treated immediately, it could lead to depression. Self-care. Self-care is one of the dimensions of self-management behavior which partly comes from the patient empowerment approach. The empowerment perspective exposes the patient acquired knowledge, skills, and responsibility for changing actions and effects that would enhance their personal health care. Figure 4 shows that most of the respondents have moderate level of self-care, 78.1%. Self-care management focuses on effort to maintain health or a healthier lifestyle. The low mean value of self-care management is due to efforts to maintain health such as diet and fluid adherence, still needing assistance from other parties, especially family and nurses. Nevertheless, patients still need to participate in the treatment and care process to reduce complications and improve quality of life. Quality of life. Figure 6 shows that the majority of respondents have a moderate quality of life, 67.2%, and none of the respondents have a good quality of life. Various studies have shown that hemodialysis patients have a poor perception of quality of life than healthy people. A significant decrease in the quality of life of hemodialysis patients is due to poor physical and biological condition, increased anxiety and depression. Actually, the quality of life for hemodialysis patients is lower than that of patients with a peritoneal dialysis or patients with kidney transplants. This is in accordance with Table 7. which states that the domains of the lowest quality of life of respondents are general health, mental health, vitality, and social function. Individuals who have a poor or moderate quality of life will experience negative symptoms of dialysis therapy, such as pain, sleep disturbance, fluctuation in blood pressures, and abdominal pain. The negative symptoms can reduce work activity so that the impact on the economic situation will decline. In addition, the lack of support and family acceptance will affect the quality of life, which deteriorates due to feeling of helplessness, hopelessness, depression, and a lack of meaning in life. An important part of the treatment process is the maintenance and restoration of independent function in everyday life. The correlation between self-efficacy and self-care. The results of the Kendall correlation analysis in Table X show that p-value 0.004 less than level of significance 0.005. It means that there is a significant relationship between self-efficacy and self-care. Previous research suggests that hemodialysis patients who have high self-efficacy will be able to perform higher physical activity and psychosocial function than those who have low self-efficacy. The self-efficacy possessed by hemodialysis patients can improve their self-care. The relationship between self-efficacy and self-care in this study can be found because patients have confidence in their own ability to carry out daily self-care to maintain health status or a healthy lifestyle. Self-efficacy is essential in developing simple and targeted implementation in supporting hemodialysis patients to manage their disease. One of the efforts to increase patient self-efficacy is to build good communication between patient and health workers. Nurses are in a position to influence patient self-efficacy and enhance their self-care activities. To achieve this, they can provide the necessary instruction for their clients to control stress and emotional as well as physical stimuli. The relationship between self-efficacy and quality of life. The results of the correlation analysis in Table 9 show that the value of p 0.041 less than 0.05, so it can be concluded that there is a correlation between self-efficacy and the quality of life of patients undergoing hemodialysis. Self-confidence is important in carrying out a variety of treatment regimens to control complications. Patients who have good confidence can relatively accept the disease and try to carry out a well-programmed therapy. Patients with good self-efficacy also sought to improve quality of cooperation, self-care, communication, and treatment adherence behavior. The health goals of patients with chronic kidney disease should focus on a level of health that guarantees their independent life. The conclusion and suggestion. There is a correlation between self-efficacy and self-esteem and quality of life for hemodialysis patients at Wates Kulon Progo Hospital. Through the results of this study, nurses are expected to conduct regular assessments of the biological and psychological aspect of hemodialysis patients, as well as to improve communication with patients in order to increase their self-efficacy. These are my references. time is enough. I hope this research is useful. Thank you for your attention. See you again. Bye bye. Assalamualaikum warahmatullahi wabarakatuh.